Hello everyone, so we have this video today. 1, 2, 3. This video today is presented by me, and I will so today's video is all about Swing, and Swing, this video is presented by me, and I will be starting this very shortly. But we're facing some technical difficulties right now. So today's video is all about English working perfectly, so we are going to now start the lecture of medicine number 3 of medicine. Also, this you can be heard as a voice record, no visuals are required. Let's go ahead and review this lecture. It's all about the cardiovascular system. This is the 4th video we are making about this subject, cardiovascular introduction, heart failure, diseases of heart valves. There are some learning objectives. At the end of this lecture, the student must be able to discuss, and we have said all of this in the previous video. Let's go ahead and jump right into the next page right here. Conducting system. This is the conducting system and the coronary circulation. We studied in the last lecture conducting system of the heart consists of the cardiac muscle cells, conducting fibers, not nervous tissues. Many conducting systems can be seen here. The conducting system providing the heart with the automatic rhythmic beats. The cardiac valves also are presented here. We can see the 2 atrioventricular valves, which are the mitral valve and the tricuspid valve. Between the right atrium, ventricle and atrium, the tricuspid, and the left, between the right is the tricuspid and the left is the mitral valve. Between the lungs, and of course between the atriums and the ventricles. This picture showing yes the right atrium and the left ventricle, cardiac cycle, and here we can see the chordae tympani and Dinah, chordae and Dinah, and the valves of the heart, tricuspid, the bicuspid, the semilunar cusps between the pulmonary arterioles and veins, and the atrium. And in the heart failure is the insufficient provision supply of blood to the lungs. Next, in the myocardial infarction, when we can see here there's a problem in the heart. Heart failure, incapacity of the heart to function properly, result from many structural and functional cardiac problems. Ventricles will fill blood failure in the lungs, liver, and perhaps peripheral tissue that impairs the ability of ventricles to eject blood, leading to pumping insufficient blood towards the tissue, or impairs ability of ventricles, both filling and ejection. Pathophysiology of the heart. We have the heart failure. The heart failed to pump enough blood, decrease in perfusion of blood organs, especially kidneys, which reduces and produces renin-angiotensin system, and the renin-angiotensin mechanism decrease the blood pressure, kidney, liver, angiotensin 1 converted to angiotensin 2 by the kidney, which causes the lung capillaries to providing or converting the angiotensin 1 to the angiotensin 2, all of course by the liver and kidney, which decreases the blood pressure, is a cause of this release. Next, angiotensin is converted by the angiotensin 2 by adrenal cortex to aldosterone, which increases water resorption, decreases urine volume, and increases blood pressure. Also, angiotensin 2 have the function of increasing the blood pressure. This in turn, of course, all these processes cause the heart to have failure, resistance of amygdala. Of course, this is all just a review of what we have studied in the last lecture. Angiotensin, renin 1, angiotensin 1, renin converting enzyme is converted to aldosterone, and aldosterone is produced and engaged by the adrenal cortex, coming into and increasing the preload of the heart, and the afterload is increased by the angiotensin 1. Afterload angiotensin 1, 2, afterload aldosterone system. Signs and symptoms of low blood pressure, as we will discuss right now. Signs and symptoms. Let's see if we can hear that now. If it's function. Yes, it's functioning properly well. So let's continue the lecture. Shortness of breath, dyspnea, as at exertion of even at rest, even heart failure, fatigue, weakness, swelling, rapid or irregular heartbeat, reduced ability to exercise, persistent coughing or wheezing with white or pink blood, tined sputum, chest pain if heart failure is caused by myocardial infarction. Left-sided heart failure is a life-threatening condition which, etc., causing hypertension, damage, etc. This is the right lung, on the left lung, pulmonary veins, left atrium, also involved in the heart failure. We have all studied these symptoms and the signs of the heart failure, left heart failure, special dyspnea, orthopnea, P&D, blood tightened, sputum, and cyanosis. Tiredness, shortness of breath, cough, pulmonary edema, cause of fluid in the lung, pulmonary action of the heart, pleural effusion, and abdomen, peritoneum, swelling of the ankles and legs. And we have the heart, congestive heart failure, also an important topic to be discussed in this lecture. And this is the normal X-ray and the pulmonary congestive edema, pleural effusion, left side heart failure, the right ventricle, all because of the right ventricle, causing the right, not the left this time, it's the right heart failure. Left side heart failure, bronchitis, emphysema, or the causes of the right side heart failure. Pleural effusion, emphysema, and bronchitis. Right sided heart failure, enlargement of the chest, normal heart, other one is the enlarged heart. Problems of the ankles and legs, swellings, reduced retraction of the skin, acute heart failure can present as new onset heart failure in people without known cardiac dysfunction, or as acute decompensation of chronic heart failure. It typically manifests as acute pulmonary edema. Causes by dysfunction of the heart due to muscle damage, coronary artery occlusion, valvular dysfunction, arrhythmia, etc. As you can see here, the balloon fluid. For stable heart failure may be easily decompensated. This must come either from an intrarecurrent illness, such as pneumonia, myocardial infarction, abdominal heart failure, rhythm. There are many other diseases causing this kind of a problem. Chronic stable heart failure may usually decompensate. Pneumonia, myocardial infarction, all are causes of chronic stable abdominal heart hypertension, restriction diet machines also are non-steroidal anti-inflammatory drugs, anemia, and hypertension, which place strain on the heart muscle. Management rule: correction, atrial hypertension, diet, lifestyle, and after the diagnosis, captopril, enalapril, ACE inhibitors, diuretics, thiazide, furosemide, captopril, enalapril, beta-blockers dioxin, beta blockers, beta ACE, yesterday I repeated the last one, beta ACE, diuretics, digoxin. Observation in dental clinic. ACE, catoina, produce lymphoid reactions. Mouth test. ACE. While diuretics can produce 0 tos. 0. Toxemia is dryness of the mouth. Moving on. Lesions can be treated. Change of offending drug. Regarding lichenoid tree reactions, only steroids might be sufficient to treat the side effects. Otherwise, or mastication. Because of the ACE and the beta. I mean the ACE and the diuretics. Le مش زائد زيروتوميا. Xerostomia. Moving on. Patients. Excuse me, this lecture, of course, can be heard as a voice record. No visuals are required, but sorry about the first part of the lecture. I wasn't explaining the paragraphs very well. Now I will. In patients with heart failure, including palpitations or dyspnea, it is important provide emergency care in the hospital. They should be placed in almost lying down position, and to avoid hypotension. In this picture, some people can see it, but most people are hearing this lecture only. Patients with digoxins intake limit the anesthetic vasoconstrictor in the carbules. Because it can affect the heart. Salicylic acid. Leading to sodium retention. Therefore, it's not good for heart patients. In the emergency, contact the medic sit down the patient and inject oxygen 6 liters per minute. Next, of course, we said it should be semi-supine position. In the hospital, while treating them the emergency treatment. Oxygen. The acute edema, difficulty breathing, coughing, coldness are the signs and symptoms of the heart patients. Moving on to the next slide we have. Nitroglyceride. Administered sublingually for the heart patients. Only 0.5 milli G in case of chest pain. And should be repeated. Sublingual nitroglycerin until the pressure is maintained. Heart valves problems. We have the tricuspid and the mitral bicuspid valves. Also the similar valves of the pulmonary valves. The aortic and pulmonary valve. As you can see in this picture, in this scale sheet, we can see valve lesions and their definitions. MS, MR, AS, and AR. They obstruction of inflow prevents filling. Only on the left ventricle. The NR is also from the left ventricle. Backflow to the left atrium. AS and AR. Let's start with AS. Obstruction to the aorta. Also to the left ventricle. Improper emptying. The AR leakage into left ventricle. During diastole. Due to coaptation, ineffectiveness. MS, MR, AS, valve lesion, AR, valve lesion, or about the left ventricle. First one is obstruction, diastolic. of the right ventricle. R, MR, between left atrial ventricle, backflow. S, AS, out obstruction during systole. Across aorta. Aortic R, during diastole, leakage of blood. Again, we will repeat this diagram or this table. This table is talking about the MS, MR, AS, and AR. All about the left ventricle. Anything with the M means between the atrium and the ventricle, and the atrium and only the left ventricle. What next? We have the AS between the left ventricle and the aorta. First one, prevent proper emptying. Of the left ventricle and the ER. Leakage of the left ventricle to the aorta. Mitral valves. The AS and the AR. AS is the emptying. AR is the leakage. MR is the backflow, and MS is the ring. Again, AS is the emptying. Leakage. Obstruction. IR is the leakage. R is the obstruction. And MR is the backflow. Congenital aortic stenosis. There is the normal aortic valves and the bicuspid aortic valves. I see no difference between the aortic valves, normal and bicuspid, except that the bicuspid one includes a bicuspid line. Congenital problem. With the aortic stenosis or the valve of the aorta. Not the mitral valve, not the tricuspid, not the pulmonary, it's the aortic congenital problem. Causing thickened ventricular wall, and we can see here the right ventricle, tricuspid valve, right valve atrium, pulmonary valves. Of course, today this lecture was very important, and we will give many lectures. Today maybe another one about different subjects of dentistry. Also, tomorrow might be we'll be giving a lecture every day, a new lecture. The Heart Sound series, aortic stenosis, aortic stenosis. Been 17 minutes since we started this lecture. Exactly 17 minutes. Not too long for very knowledgeable information and a very important subject to be discussed. Next. Aortic regurgitation. Again, aortic regurgitation. Aortic valve. Left atrium. In this picture we can see mitral valve, atrium ventricle, thickened. On the aortic valve and the right ventricle. Moving on. Heart sound. Mitral valve. The mitral regurgitation. It's blood backflow from the ventricle to the aorta. Valve lesions, MS, PS, and AR, beginning the obstruction of the aorta of the ventricle left during systolic circle, as we studied, during diastole, improper filling of left ventricle, dyspnea, fibrillation, hemolysis, diastolic murmurs, all are causes of MS. Again, dyspnea, atrial fibrillation, hemoptysis, diastolic murmurs, where we going for that? MR, which is regurgitation or backflow of blood from the left ventricle to left atrium during stall. On this MR causes dyspnea, murmurs, but it doesn't cause hemoptysis, a fibrillation. AS includes aortic obstruction between the left atrium, left ventricle, and the pulmonary vein, artery. Also, prevents emptying of the ventricle during systole. Causing dyspnea, angina, syncope, death, ejection of members, but it doesn't include fibrillation, nor hemoptysis. The type of mirror: systolic mirror, not pansystolic, not diastolic. As we remember, the backflow from the blood and insufficient flow from the blood, not obstruction of the blood from the atrium to the aortic or leakage. LV and aorta during diastole. This one causes dyspnea. Also, just like the MR, the MR being the backflow also. Orthopnea, a special case. Paroxysmal, nocturnal, and nocturnal angina. Palpitation, white pulse, diastolic murmur, investigations of the MS, the obstruction of the ventricular during diastole, as we studied, improper filling by SHA, fibrillation, enlargement of LA, CXR, enlargement, congestion, echo, of the matter of health. We see if it's healthy or not. MR is the one with our backflow from the ventricle. Left. SG echo CXR. Here's this time is during stall, obstruction of aortic artery. As we read, which causes improper emptying of L. B. Causes one. Pays special focus. Pay special interest about ECG or AS. Last one, AR. AR is the one with insufficient flow of blood from ventricle to atrium. Left. during test CXR echo and orthography is special. Treatment MS beta blocker, CCBs, diuretics, balloon, E, treatment. The MR the one with insufficient flow during systole or backflow from atrium to ventricle. Vasodilators, rate control, beta blocker, CCB, digoxin. Anticoagulants, diuretics, prophylaxis, like mitral valve replacement. Just like in this picture, you can see a catheter inserted into the heart and a balloon enlarged, allowing the mitral valve to be fully opened to prevent the backflow of the blood from the atrium to the ventricles during systolic cycle. Except that it's between the right atrium ventricle, allowing the deoxygenated blood to go directly to the left, to the right atriums, and the right atrium pushing the blood directly to the left ventricle. Treatment: AS, pulmonary obstruction, general dental procedures, medication, balloon, surgical placement, we can do little to help except for surgical treat. And that happens during diastole. Next, they are during systole, during diastole. The previous one is the AS during systolic. So this one during diastole, the backflow of blood from the aorta to the ventricle, or insufficient left atrium pumping. Prophylaxis, vasodilators, nifedipine, stroke volume reduced regulation, only if the patient is hypersensitive. Is used with the hypersensitive nifedipine to it. The ventricle is surgically. Thank you for listening to this lecture. Well, that was a very important lecture. We discussed all types of heart failures, and we will go in depth in the next lectures, discussing why there is an intervention of the surgical balloon between the left atrium and left ventricle to treat the MS, obstruction of the pulmonary artery, obstruction of the left ventricle arterioles. We put a balloon between left atrium ventricle to prevent backflow and to attach it with a catheter to the right atrium just to fix it in place. And we talked about the signs and symptoms, radiography, angiotensin problems. Thanks for listening.